Hello, and thank you for joining us again for our weekly COVID-19 update. I'm John Eller, Davie County Manager, and on behalf of Robin West, Assistant Manager, and the Board of Commissioners, we appreciate everyone tuning in to us again this week. We thank you for everyone on this call, the emergency operations team, for all their hard work and all they continue to do to support our businesses, our citizens, our nonprofits, and our churches, and the list goes on and on. Just the partnerships have been great, and we appreciate all that each of you do in the role that you play. I know some weeks we have more updates than others. Some weeks things may not change a lot and stay the same, but we continue to use this as a mechanism to get information out to our residents about things that are occurring in the world of COVID-19. So with that, we'll transition over into our first weekly update from our superintendent, Mr. Jeff Wallace, from our Davie County school system. Mr. Wallace.
Good morning, Mr. Eller, guests, staff. Thank you very much, and community. First, I want to start out this morning with thanking our staff and students and parents and community as we've worked through one of the most difficult times our country has seen in over 100 years with the pandemic, and it's been very difficult. We've made mistakes, but we continue to stay focused on safety and meeting our learning needs. At this time, I want to move to another point that's disturbing, and we're all aware of the past few weeks, and our nation has been rocked again with another tragedy at the death of George Floyd. And locally, we had some students that sent out a short video that was racial in nature and was not appropriate. And I want you to know that any act of hate and racism is absolutely unacceptable anywhere. I'm proud to live in the community that I live in, but we are not. We do have some situations, always will have some situations we have to deal with, but Davie County Schools must be a safe and safe place for every child and every adult that comes to us. And so as a community, I hope that we reach out and work together. We are taking steps within our system to address this and make sure, again, that every child, no matter your condition, situation, what you look like, feels safe. And I hope and that the community would join us. And again, I'm thankful that we live where we do, but at the same time, we must always step in and address our problems. Next thing, we closed schools on March the 16th. And as you all know, that according again to the governor's directives, one of the challenges or directives was to provide meals for students. To date, we have provided, since March the 16th, our school nutrition staff has provided and delivered 340,000 meals to families. That's absolutely an amazing job. Good work on Mr. Selecki and his staff, their team, good job. The feeding plan will continue into the summer. It'll be revised slightly now that school will be officially over as of today. And but we will be 30 mobile sites that fields will be served, and there will be 3 schools that will continue to provide drive-through meals. Next topic, we received guidance. The school system received guidance from Governor Cooper's office this week about reopening schools. Superintendents expect to receive additional information today from Department of Public Instruction and the DHHS services as well. So we will continue to unpack that plan, and we are working diligently to put plans together for reopening school for next year. What would that look like? Either returning as we have in the past? Will it be some type of hybrid schedule where some of the students are there part of the time and some are not due to social distancing requirements or safety precautions? Again, I want to thank Suzanne Wright and her staff and John Eller and local physicians for meeting with us and sharing insight as we build these plans. We're also building our summer academic camps and plans that are mandated by the state to help recover some of the time that we've lost. We are moving forward with kindergarten camps, and plans are being made for all of those, again, in light of the guidance and regulations provided by the Governor Cooper's office and the DPI. So more to come, and we will continue to open our facilities within limitations and guidelines and make sure that we're maintaining safe environments. I also want to take this time to say thank you to some leaders in this county, particularly Terry Brawley and John Eller, along with the leadership teams at Yadtel, for all of us sitting down at the table and having an open discussion about the possibilities of being 100% connected to the Wi-Fi or internet in Davie County. This would be a huge step forward for the school system, for businesses, the medical community, and all stakeholders. So again, we are just in the beginning stages, but I want to say thank you very much just for the leadership and the forward thinking for each of those groups. And I will end with another congratulations to the early college graduates and to the Davie County High School seniors that will be graduating this Saturday morning at 8:30. And again, thank you, John, and that concludes my comments.
Thank you, Mr. Wallace. We appreciate all that you and your staff are doing. It seems like we're all doing contingency plans and concurrent plans, and a lot of planning going on right now because there's a lot of unknowns ahead of us, but we appreciate the effort and the vision that you and your team have. So thank you so much for all that. We'll transition now into our weekly Health and Human Services update. I appreciate, I know the Chamber has stated this to us and a lot of businesses as well. We know how hard our Health and Human Services team are working right now and trying to be a resource for so many people in the county right now, from residents in the community, also just seeking services, but then also the businesses in our community that are relying on Health and Human Services for technical assistance and consultation, and heard a lot from our business community about how much they appreciate the advice they've been given, and from the Chamber as well. So Ms. Wright, thank you for all that you and your team are doing regarding that, and we look forward to your report here today. So thank you.
Thank you, Mr. Eller, and I appreciate all the businesses and what all they're doing to try to control the spread of this virus. And I know that Mr. Wallace and his team are faced with planning above and beyond what most people realize, and they've done an incredible job, and they're going to continue to do great work. I know that. So thanks to Mr. Wallace and his team too. But Davie County has 127 COVID-19 cases as of today, as of this morning, and that's 22 more than last week. 64 of those remain sick, and 3 of the sick are hospitalized at this time. And I always hate to report this, but one of our residents died from complications of COVID-19 this week, and our prayers and thoughts continue to be with that family. This is the 3rd COVID-19 associated death in Davie County. North Carolina Department of Health and Human Services is planning to begin posted COVID-19 clusters in child care, school, and other occupational settings. I talked with Mr. Wallace about that this morning. For these particular settings, a cluster is defined as 5 or more cases, and these cases have to be linked. That's 5 or more cases over a 14-day period, and they have to be linked to like the same class, same work area, same shift, those kinds of things. So that information will be reported on the NCDHHS website. The one for child care centers will begin being posted on June 22nd. And then the information about schools, that will be posted as soon as schools either start summer school programs or once they start back the regular school year. But again, that information, you'll see the county, it'll say Davie County facility type, whether it's a school or a child care center or a business.
Pause right now or silent.
Then the name of the school or child care center or facility, and then how many cases and or deaths are associated. So we hope none of the above, but just want to let you know that that's coming soon. The public health call center remains active. Testing and contact tracing continue to increase. We're in the process of implementing a new contact tracing tool that was developed by NCDHHS and its partners. And once that's implemented, the health department will be enlisting the help of additional contact tracers to support call center operations, because our folks are working around the clock right now. And so we can have 1 positive case and they can have 50 close contacts. So those are calls to 50 different people for one positive case. So as you can understand, these calls and contact tracing continue to increase. As a reminder, for those looking for testing sites, You can reach out to your primary care provider, Davie Medical Center, the Wake Forest Baptist Urgent Care here in town, the health department, and for all the sites locally, please call 753-6550 and we can direct you appropriately to those places. For antibody testing, I know a lot of people have had questions about where they can go to be tested for antibodies. That is not being done at the local health department, but again, if you call 753-6550, we can point you in the right direction. So if you have any questions, again, that number is 753-6550. Thank you.
Thank you, Ms. Wright. We appreciate all you and your team have done, and our prayers go out to the families of all those who've been impacted by COVID-19. So thanks again for your efforts there. We'll now turn it over to our update from our sheriff, Mr. J.D. Hartman. Sheriff.
Good afternoon, everyone. We definitely have seen an uptick in call volume, which puts us back at what would normally have been the volume or call volume prior to the COVID crisis. Staffing levels are good still, and we're handling everything that comes in. The biggest changes, again, are the court system, which reopened. We had civil court, district court, and superior court going on this week, and that process is working great. Just remember, if you come to the courthouse, you might be here a little longer than normal, and it may take you a little longer to actually get in and into the courtrooms. There's a process that you go through to get where you need to be. And that's really all I have, Mr. Eller.
Thank you, Sheriff. I know how hard you and your team work to do just everyday related stuff, and now adding the reopening of the courthouse and working on that with the judges. We really appreciate your hard work there, so thank you for that. We'll now move on to our next update and presenter. We have Mr. Brian Bird with us from our Emergency Services Department. Mr. Bird.
Good afternoon, everybody. It's been a good week at Emergency Services. Impacts from our state of emergency and from our coronavirus emergency are manageable. We've been receiving sheltering recommendations from emergency management this week through DHHS because, again, they're preparing for storm seasons. They're really worried about impacts on our coast with people moving inland to get sheltering, and how will we manage that with the community spread of coronavirus. For Davie County, if sheltering is needed, we'll be expected to move away from having the large shelters that we're normally setting up. Those shelters have a lot of cots. We'll have the same locations. We'll be having less cots in there to keep people a greater distance apart. We're, of course, being encouraged to keep household members together. First, though, what they're expecting us to do is to work with local hotels to come up with blocks of rooms and to work with smaller groups through the hotel system. And lastly, we're being told to have these folks call on family members to have lodging with family instead of being put in a situation where we're having to be in congregate sheltering. So a lot of stuff's coming down, a lot of management in those areas. We had a meeting with Red Cross this morning to try to work out some of these things. North Carolina Emergency Management, they continue to support us in all the counties with PPE. I got a request in for some coronavirus testing supplies from our local health department. We'll be working on that today. We also continue to work through our processes to try and receive some financial relief wherever we can through FEMA. And I'd like to say that as far as the call center that Suzanne spoke about, here at Emergency Services, we use their call center. We get a lot of good information from them. We stay in touch. We try to work through problems going in both directions. And some of our employees have been able to use that call center and some of the testing facilities that they provide. So we appreciate that. And that's all we have this week, Mr. Chairman.
Thank you, Mr. Bird. Yeah, when it comes to emergency management and prepping and doing what needs to be done there, when you add storms to everything else we're dealing with, that adds a whole new dynamic to it. So thanks for your hard work there, and we appreciate that. We also appreciate you helping be a point person for FEMA for us, and also for ordering PPE. we've talked about before how difficult it is sometimes to find adequate supplies, and every county across the state's dealing with the same thing right now across the country. So we appreciate you partnering with us and all that you and your team does for us. So thank you. We'll now transition into our next update here. We have Mr. Rodney Pierce from our 911 Communication Center. Mr. Pierce.
Thank you, Mr. Eller. Just to reiterate what the sheriff mentioned, our call volume is returning to summertime or normal levels during this time period. We're still processing calls with screening questions, so we're asking citizens to be patient as we go through that process. Again, our resources are posted up there for information as far as the Davie County Public Health Line, and also 211 for state information. We're maintaining constant contact through the North Carolina 911 Board. They're continually doing weekly checks on us to see our status if anything is needed. At present, we are fine and good. So with that being said, I'll turn it back over to you. Thank you.
Thank you, Mr. Pierce. We appreciate all you and your team do for us. And we'll now move into our public utility update with our Utilities Director, Mr. Johnny Lambert. Mr. Lambert.
Thank you, Mr. Eller. So public utilities, we're still working under the governor's executive orders, and those executive orders consist of us not doing any disconnection of service. We're still suspending all late fees and penalties under that executive order. But we're still asking the residents, if you are having trouble paying your bills, if you haven't paid your previous bills, to please call our office and please talk to staff and let them set up a payment arrangements for you, because we don't want you to be in a worse place later. And that number to call is 336-753-6090. Also, we're still the reopening of the buildings. We know a lot of people are starting to reopen and use water, and we're asking to make sure that the CDC has put guidelines out for when you're reopening buildings to flush the water, make sure you get clean water through all your pipes so there's no odor or taste problems in the water as you move forward. And I just want to thank everybody, being in these, the citizens, staff, everyone's worked together in this, and we've made the best out of a bad situation, and I just want to thank everybody for all the hard work. Thank you, Mr. Eller.
Thank you, Mr. Lambert. Your team works hard, and like everybody else on this call, you're a very, very important person of our team, so we appreciate that work. So as we wrap up this week's session for you here today, please continue to get your questions and comments to us. We have the site that you can go to there on your screen to be able to do that, and we'll continue to try to address any themes or questions that we get. As mentioned earlier, and as you heard from Ms. Wright's updates, again, thinking about all those impacted by COVID-19 right now who have been sick or who have lost loved ones due to that. Let's continue as a community to remember those individuals. And then, as Mr. Wallace led off today, continuing to think about our country and what we're seeing in the news right now, and just think about those individuals impacted by those hate crimes, and we just our prayers go out to them as well. So again, as noted, Davie County is a great place to be. We have lots of good partners, many of which are on this call, and many of which partner with folks on this call. And I think we're all doing the best we can, as Mr. Lambert said, with what we've been given, but we couldn't do it without so many partners and a great community and a great volunteers, great churches, a great responders. So it definitely is a team lift and takes a team effort, but I'm very proud of those on this call. I'm very proud of our community. And we will return to you at this point in time next week for our next update. And thank you for your time tuning in for us during this session. So with that, we'll wrap it up for this session of COVID-19 in Davie County for this week. Take care.